I saw this morning where our hand sanitizer been ripped off the wall.
Really?
Well,
I thought maybe
I'm
you guys
trying
requested
to
it.
build it.
I know you're over there occasionally.
And maybe what?
Maybe trying to fix it or something or something.
Oh, it's been empty for 2 weeks. All right. I see them there wiping stuff down. So I know they're at least wiping stuff down.
And you're doing the same thing we're doing for trash, just
Put it out in the hallway.
corner area.
Yeah, and I walked right past that this morning and didn't put it back in there. Oh, well.
Well, I'll work on it.
Good early afternoon. Welcome to Emergency Response Committee, meeting of Monday, May 11th, 2020. Notice the meeting was properly posted on May 5th, 2020. We'll do a roll call. Mr. Matthews.
Present.
Mr. Blau. Here. Mr. Taylor.
Here.
Mr. Davidson.
Here.
And Barnes is present. Thank you very much. Going to, unless there's objection, move to item number 2, discussion possible action. Oh, I'm sorry, got to approve the minutes of 4/27/20. Do I hear a motion to approve?
So moved.
Second. Motion and second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And Barnes is an aye. Thank you. Item number 2, discussion and possible action to set date, time, and place meeting will reconvene if any technical difficulties that cannot be corrected in 30 minutes.
I would suggest noon Wednesday in this room.
Second.
Got a motion and second for noon Wednesday in the BOCC room, which
And just for procedural process, the committee's all here. So technical difficulties because people that may be called in.
Called in or on broadcast.
And is a requirement of the changes made to the Open Meetings Act.
Yeah, to your point, I asked the same question last week. So
Well, and so Open Meetings Act is now this way, period.
If you're utilizing the provisions of either teleconference or video conference, and your membership is shown as appearing via video, which all of us are shown with that option, you must establish a time and a place to reconvene in the event of technical difficulties. Keeping in mind that just because I'm listed as showing appearing via video doesn't preclude me from showing up in person. Additionally, we have been recessing this meeting on a fairly regular basis, and it may be that I exercise my right, as stated under the agenda, to appear via video. So that's my understanding, Michael.
Well, I'm just getting clarification, and I don't have a problem with that, because now that I see the whole committee here, and I think as a convenience, we've been posting it that will show video or audio. But I'm fine. I'm just trying to understand the concept of the process.
Well, and we also have Chantel who's appearing, Sharon is logged in, so they're not here either as part of this group.
I have no other questions.
Thank you. Appreciate the question and clarification, Mr. Blount. Have a motion and a second. Should technical difficulties arise, to reconvene noon Wednesday, May 13th in the BOCC room. Mr. Matthews.
Aye.
Mr. Blount.
Aye.
Mr. Taylor.
Aye.
And Barnes is an aye. Thank you. Item number 3, discussion, review, possible action regarding presentation from emergency management, health, and/or safety professionals. Would entertain a motion to open item number 3.
You don't need it.
Don't need it, okay. I'll just give you a report.
Golly, again.
All right, first week of May, historically peak of spring severe weather season, as we've been discussing. This week, we do have a chance for severe weather on Wednesday. And there's rain off and on all week, as would be appropriate for a major roof job on this facility. Persistence and preventative measures, including limited travel and staying home, is still more important than ever. We're still under presidential declaration. CDC specific guidance recommends wearing cloth masks when around other people, and all organizations continue to use the business continuity of operations planning. Oklahoma is under a state of emergency declaration and a health emergency declaration. And Governor Stitt recently announced, I'll just read this, that Oklahoma is on track to begin phase 2 of the state's reopening plan starting May 15th. During phase 2, elderly and vulnerable individuals should still follow safer home guidelines. Non-essential travel can start resuming, and organized sports activities can reopen while following social distancing guidelines and sanitation protocols. Additionally, bars can operate with reduced occupancy while following social distancing and sanitation protocols. Funerals and weddings can resume with more than 10 people. And that's to take place presumably May 15th, as per Governor Stitt. In the state, we now have 4,613 positive test results recorded, with 274 virus-related deaths. Largest numbers are still in Oklahoma County with 43 fatalities, Tulsa County with 36, and Cleveland County with 32. And there have been 85 seasonal flu deaths since September 1st, with 3,516 seasonal flu hospitalizations September 1st through April 18th. Still 71 counties in Oklahoma who have had or are currently experiencing positive cases, and 3,241 Oklahomans have been documented as having recovered from diagnosed COVID-19 as of today. Test sites are still in operation throughout the state. Recommend looking at the State Health Department website for specific locations and guidance, as requirements do vary depending on the test location. And the State Department of Health online symptom tracker and data dashboard are still available. First responder protection information still being provided on positive case addresses and patient names. National Guard is still deployed in various capacities and medical-related missions in the state and in support of strategic national stockpile activities. Department of Corrections numbers have not changed since reported last Friday, and Forestry Services continue to support PPE distribution. Fraudulent unemployment claims continue to rise, and we continue to see efforts at the state to increase the legal aspects of that as the numbers continue to go up. It seems like every other day, I'm sure Dan, you as well, get additional reports of additional claims filed fraudulently. So that continues to be a significant issue. In Oklahoma County, we had 945 positive cases documented, with 43 fatalities, as I mentioned. And there's still documentation of 26 positive cases at Tinker Air Force Base, with restricted visitor guidance in place and revisions in available gate access. Oklahoma City County Health Department Nurse Hotline 425-4489 is still active, as is the state 24-hour hotline 877-215-8336. Telehealth providers are continuing their coordinated efforts, and that's for physical health issues and for mental health issues. Shelter operations continue in the Oklahoma City area for homeless, both symptomatic and asymptomatic situations. And skipping down here a little bit, shelter staff and guest screening continues with continued assistance and oversight from the Helping Hands organization. And they are still continuing outreach to the homeless population that is currently not in a shelter. PPE supply lines are improving, although there are still some challenges in some areas, and we continue the Oklahoma County Emergency Management personal protective equipment point of distribution process, and have been doing weekly distribution activities in regard to that. One note of interest, during a conference call late last week, one of the local EMS providers made a comment that there is an apparent trend of people tending to let their guard down because of relaxed guidance, and also included multiple instances of asymptomatic persons now testing positive. So test results are still an issue, whether symptomatic or asymptomatic, and just because someone tests in one capacity on one day does not mean that that's going to remain in place for a lengthy period of time. Internal Oklahoma County government, we're still under an emergency declaration as of March 25th. There's a draft reopening document provided to members of this group for review, and we have received guidance from the district attorney's office and Judge Elliott in regard to activities in the courtroom. And I just came from a meeting with Judge Elliott, and he was wanting to reemphasize the need for sneeze or cough screens in the courtroom before they are able to open. And I'll discuss that with you, Mr. Monroe, when we get through this meeting. He showed me exactly what he was looking at. I understand that the trim carpenter is having some challenges right now, and there's an obvious need throughout the facility for those.
Can you go over that?
I'm sorry?
Can you go over that? I don't know about the rest of the crew, but I think that's the first time I've heard about sneeze guards actually in courtrooms.
Yes, he's requested a very small screen between where a witness or someone who is testifying will be sitting in the court reporter, which is roughly 10 to 12 inches apart. He's requested a small sneeze screen there, and then one in front of the actual judge's seat. And I believe that was it. He's also interested in protecting the integrity of the courtroom, the physical woodwork and all that kind of stuff. So suction cups or some form of temporary that does not damage that would be desired. That's just a thought, something.
So how about felt?
Yeah.
How about we go with pine as framing material and felt? It would accomplish the same thing as a suction cup, prevent scratching of the wood. If this is,
I'm not sure. I don't. I'm not a courtroom expert, not a lawyer, but I can't recall the last time that somebody was within 6 foot of a judge in their chair, other than somebody testifying on their left or right, and then a court reporter on their left or right.
compromises at the bench, Mom.
Yeah. So
Yeah, I can understand the request.
are those usually aside, or?
The one time that I was in a proceeding where that occurred, it was,
I mean,
if you were the judge, they would be standing at the marble there. Yeah.
Has this been asked for every courtroom?
Eventually, I don't know for sure because I don't know the subdivisions within the court system over there, but he did mention civil courts and he mentioned criminal courts.
Have you heard about this? Is this the first, or?
There were little discussions and no discussions, but casual comments, basically, that the courthouse might want to sneeze guards for their purposes. I think they can do a better job of distancing instead of the amount of space they have to work with. But I don't know any of the specifics, and plexiglass of late has been difficult commodity to come by.
Very good. We did have a very positive discussion, and I assured him that I would relay his desires to this group and discuss with you further.
Wasn't something said last week in reference to putting plexiglass up in the courtrooms?
I believe Renee referred to it when she was here doing reports.
So at that time, was there any, or are we working towards doing something in what she had asked for?
I don't think so. Our trim carpenter has been out, so his availability limits our action.
I expressed that to Judge Elliott as well, that I knew the man who was doing the trim work and installing those in other portions of the facility was out on a medical issue. So availability would be questionable.
And again, I don't know what would need to be constructed specifically and installed in such a way that woodworking, damage, you know, I'm not personally taking a look at how things need to be together and what specifically they're asking.
I'd be happy to go over and show you what he showed me or me on
I'm sure
him.
it sounds fine.
Yeah.
And that may vary from courtroom to courtroom.
Minimally, according to what he expressed to me anyway.
Yeah, which judge wants it and which judge doesn't want it. Yeah, oh, yeah.
District Attorney's Office is returning to full staffing May 18th. The Oklahoma County Court Clerk's Office still doing marriage licenses with pre-prepared paperwork being brought with the people who are seeking that license and appointment as necessary. And the County Clerk's Office is shifted to a 9A to 3P schedule. The County Treasurer is taking cash payments on third floor, one person at a time, as required. May 8th, last Friday, there were 243 through the door, which is the largest number we've seen so far, with 15 inmate shuttles and VPOs, marriage licenses, still creating significant traffic along with property tax. Thanks. The PPE pod still in place. Did visit with the law library last week. Helped her look into some issues that help social distancing in the law library. Would get emphasized. The law library is a catch-all for people in between cases and doing research, obviously, but also waiting for the docket to come up, whatever. And that activity is going to be significantly limited. The number of people are going to be in there. I have to be a little more specific about when they come down and go through whatever. So with large numbers of people in areas. Oklahoma Medical Reserve Corps is still soliciting medical and non-medical volunteers. Warning signs and symptoms for the CDC have not changed, and personal protective measures have not changed either. A reminder, primary method of spread is person to person through coughing or sneezing in contact with airborne droplets. Taking personal responsibility and practice prudent preventative measures is still warranted. And per information from City County Health Department, as I emphasized last week, the use of N95 and similar mask is actually intended for healthcare workers and those that are collecting samples. The guidance for general public is a cloth mask or the surgical type mask. Unless there's questions or further discussions, that concludes my report for today.
David,
Sir.
phase 2 is when potentially?
May 15th.
And you said outdoor, or you said weddings and funerals could resume.
That's correct.
Currently, the guidance is limited to, I think guidance is limited to 10 or less, is that correct?
Yes, and they are saying that they can resume with more than 10 people.
Is there a cap on that number?
Some guidance I've heard talks about the number of 50, but the release I got did not indicate that.
So 50 would, if that is in fact the case, would tie to some of the guidance that we received as this initially became an issue. Okay. In phase 2, bars and restaurants cannot be open.
They can't open with sanitation protocols and social distancing guidelines.
And the reason I'm kind of asking these questions is it was my personal observation when I was out walking this weekend that social distancing is really in the eye of the beholder. It happens to be, I guess, what would have been graduation weekend at the University of Oklahoma. As my wife and I were out walking, there were a large number of people that were out and about. Some of the restaurants on Campus Corner had reopened, and there were a lot of people congregating. And where I'm going with this is I saw a couple of things of note. That one, there was a report that Georgia, I think it was, I don't know, but Georgia had experienced an influx of people from states where restrictions were still in place. So it's going to be interesting to see what comes of that. We see new clusters popping up. And then there was an interesting story that I saw this morning. Now, given we're a whole world away from South Korea, but people being people, we very much have the same habits. And South Korea has moved into the phase of their bars and things being open. And lo and behold, they saw clusters and they've now reversed course. You mentioned earlier, people are beginning to put their guard down a little bit. As a group, I hope that we do not do so, and that we remain vigilant in trying to come up with the best course of action here. I think we've been able to serve, all of the offices have been able to serve the public well, understanding the need that the courts need to get back, but they seem to be taking good precautions to do so. But that we wouldn't, constant refrain from me is we don't need to rush. Otherwise, all the good work that has been accomplished goes down the drain, and we find ourselves right back where we're at in a matter of weeks or months. So I hope people are paying attention to what's occurring.
Agree. Thank you for those comments, Joe. I'm certainly in agreement with that. I think one of my concerns is not only from the EMS provider, which is from an ambulance service, so they've got a broader perspective than just a single department talking about that relaxed guard. As we see these social changes in the community, even if we remain vigilant in what we're doing here, I'm afraid we're going to see some overflow from the social settings around us potentially impact us here, which further emphasizes what you're saying, that we need to remain vigilant in our state.
And then mentioned EMS, and so brought that out to the first responders. How are we in terms of at least those that you're providing for and meeting their needs for PPE, et cetera?
They are in good shape, and we've been able to not only provide according to the requests that they give us on a weekly basis out of the Strategic National Stockpile, but I've also seen various entities sharing resources among different entities. If they hit midweek and something occurs where they have a higher demand, they're able to share among these communities and other first response agencies. So while it's not perfect and the supply chain still has some challenges, greatly improved over what we've seen previously.
With regard to the supply chain, greatly improved, is that in terms of where we're at today in the cases we're seeing? In other words, if we experience an uptick, will we be back where we were when this thing started and the supply chain will then be struggling, or are they able now, is the general feeling that we're now able to slightly get ahead of the curve and be able to deal with really what will probably be coming?
Yeah, that's a great question. I think it's dependent upon just how much of a upswing we may potentially see. If we saw a substantial increase in the number of cases, I think we could be challenged. If it's a moderate increase, say 5%, something like that, that levels out and people see, wow, maybe we rushed it and then start implementing it and re-implementing protective measures, and it does level, I think we'll be in good shape there. If it's a substantial outbreak, the supply chain has improved and availability, although there's still a delay in getting those materials. So it's going to be kind of a balance.
Okay. And then one thing that we talked about last week, and you mentioned possibly 1,000 people to do contact tracing. Do you know what kind of progress is being made in that regard?
I do not. I don't have an update on that. That would likely be a coordinated effort out of state health, and they're looking to local jurisdictions and local health departments to county level.
And that would be OCCHD on our end.
That's correct.
And that is a necessary component of moving forward.
Yes, that's what
That hasn't changed.
that's correct. It's still included in the guidance that we've received, both presidential and CDC. Any other questions or discussion?
Move to receive the report.
Second.
Got a motion second to receive the report. Mr. Matthews?
Aye.
Wow.
Yes.
Mr. Taylor?
Aye.
Davidson?
Aye.
Barnes is an aye. Thank you. Item number 3, discussion, review, and possible action regarding, number 4, regarding presentation from VOCC departments. Any VOCC departments, send any information here to present online or otherwise? Hearing and seeing none, no action on item number 4. Item number 5, discussion, review, possible action regarding presentation from facilities management. Mr. Monroe?
We have 20 additional cleaning staff on the premises today. I'll know more after 2 days' time, the rate of usage of the cleaning resources and PPE that we're expending and moving through. I want to thank our janitorial contractor, UBM, for providing us these people on short notice, and also my administrative staff, and particularly Megan Detterman, for organizing and positioning these people throughout the complex here. So
Very good. I've had discussions with, I'll say that for the elected officials. All right. Any questions or discussion from Mr. Monroe?
Move to accept the report.
Second.
Motion second to accept the report. Mr. Matthews?
Aye.
Wow.
yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Thank you. Item number 6, discussion, review, and possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor, District Attorney, Public Defender, and Oklahoma County Courts. Their offices are represented. I have information from any of those departments.
Sounds like you do.
I do.
There was a district attorney opinion
Actually, from the
or guidance.
assessor's office. I've been in discussion with them, and so plans that they've been moving forward. Mr. Monroe and his staff have been involved in those discussions as well. How they treat their personal protective equipment, i.e. mask, daily regimen there, which part of what they had originally intended is not feasible due to staff limitations. But the spray material that I currently still have some available, I think will meet their needs in that regard. They can provide containers that we can put that in that would allow them to spray those masks. I think will be okay. We did also receive guidance from Presiding Judge Elliott. I'm not sure if everyone received a copy of that. I received a copy last week and have reviewed that. And I did mention that to him when I was visiting earlier today. He has made multiple revisions in scheduling, staggered scheduling, the number of people in courtrooms, whether people will be basically holding, awaiting their case. There are elements in there in regard to attorneys filing the paperwork. There are elements in there in regard to attorneys when they come to the courthouse and immediately leaving, and even down to the detail of when they approach the bench, those kinds of things. He did prepare and provided what I viewed as a pretty extensive document addressing a lot of different issues. And it's being applied.
I'd like to make certain that it's clear that when asked, facilities is not going to clean individual masks or PPE. I think that falls to the individual using them themselves. So just so that there's no misunderstanding, we've been asked to do that, and I'm sorry that that was a flat refusal on our part.
Should be.
Certainly agree with that. Any other discussion from any of these elected officials of the offices that I named, or other information pertinent to those groups?
You mentioned guidance from the district attorney's office in your opening remarks. What kind of guidance did we?
That would just be the discussion we had when Mr. Prater was here and visited with us as a group last week.
Okay. Not a response to any official question about what we can and can't do.
Oh, no, sir. I've not seen that. Any other questions or discussion?
Well, how many questions were asked?
Basically, the gist of the question was, is it permissible to take the temperature of all persons entering this building? If it is permissible, would that need to be done by a certified healthcare provider? And there were questions relating to record-keeping requirements, HIPAA, ADA compliance, constitutional issues to be addressed, access to the courts among those. Let's see. That was generally the gist of the question, and then there was a broad statement at the end of the question. If there's anything here that I've missed that is an issue, please provide guidance on that as well. Thank you.
And we're looking at opening May 18th,
Next month.
1 week from today.
And I think if you'll recall, Carrie indicated that that was near completion and thought we might have had it on Friday. I anticipate we'll get that in relatively short order. I would feel confident that we'll have that prior to what I anticipate us getting back together on Wednesday. That's my anticipated motion. Any further discussion?
Move to accept the report.
I'll second that. And motion second to accept the report. Item number 6, Mr. Mackey.
Aye.
Mr. Blount.
Yes.
Mr. Taylor.
Aye.
Mr. Davidson.
All right.
And Barnes, aye. Thank you. Item number 7, discussion review, possible action regarding reentry provision in the plan Shelton County offices and facilities. A big piece of that is what you just
Yeah. I'd like to reiterate, we are 1 week away. We were told that this would be done quickly. 1 week away makes it very difficult to purchase the things needed, move in a rapid way to be able to implement things that we are able to implement. So quicker the better.
Joe, were you able to secure your signs to be brought down?
Not yet.
So other than the things that you've emailed out, Mr. Barnes, which have never been voted on to enact, really we're in kind of a holding pattern. Is there anything that we can do without what we perceive to be guidance from the district attorney's office?
I think some preventative measures have been implemented. I've got a limited supply of surgical masks on site available for folks who may arrive and not be following recommended practice. So we can fill some of that gap. And I know, as Mr. Monroe just iterated, the sanitation procedures and cleaning have definitely popped up. 20 people might walk over and up to the 7th floor of the courthouse. I saw them all over the place.
They're everywhere.
There's an excellent presence there. I think those are the main things up front. Other preventative and precautionary measures, we're still certainly waiting for clarification.
Yes. You know, the re-entry part of that is what I'm concerned about. And that's stuff that we've had ongoing since, well, for at least almost 2 months now. So
That and the alternative.
my concern
for employees.
is the re-entry. Let's give everybody some sort of time to be able to act. You had mentioned you've got new disinfectant. I read a big deal about New York subways are using UV ray cannons to disinfect. Now those can't be used in normal operating hours, but they seem to be a very quick, very effective, easy way to do a mass disinfecting? Have we looked into those, thought about those?
I have not, I don't know anything about them. I just wanted to comment or discuss, perhaps, as people begin to move into the building, we'll be met with new challenges. Will we make these observations and then bring them back to this body to search for solutions? For example, there were a number of people that came into the annex just late last week. Half of them wearing masks, half of them not. They all congregated at the entrance there at the security checkpoint, as if they had no idea what was going on down here. When people make these observations, is there a forum, is this body, to begin to identify specific problems to be addressed? I know we all will be watchful because we're dealing with this, but when we see particular problems that need to be addressed, it's this venue, is my guess, that we'll discuss and hammer out these things. And how frequently should these observations take place and solutions sought?
I believe this is a proper body for that, although if there's something emergency, it probably would behoove us to discuss further with the sheriff's office folks that are on site, particularly leadership there, and encourage them in the direction that we're going, make sure that we're on the same sheet.
Perhaps we include some report from the sheriff's department, those guys that are working down there at the checkpoint, a report from the court administrator on issues that they're experiencing over there.
As we reopen next week, it may require us to meet on a daily basis again to address those issues that may be coming up.
Or twice a day. I mean, I envision that when we open up, I mean, as it sits right now, we don't know what we can and can't do. I'm told that we would find out very quickly what we can and can't do. As soon as we know what we can do legally, I mean, at one point, and I don't even know that this has been answered, can we provide PPE to the public? Because at one point that was questioned. I don't know that that's ever been written down, an email or a statement given. Can we give PPE? I mean, my personal opinion is we've been giving PPE to the public for decades. They're called toilet seat covers. So I think some of this is going to be, and I understand what the lawyers are trying to do. They're trying to get us to a zero risk factor. Zero risk factors don't exist. We are going to have to take on some risk.
So I can eliminate part of that with a motion that regardless of what the VA's opinion is, that we recommend to the BOCC that they do not do temperature screenings as a means of determining who can and cannot enter this building. Right? With all the things that I've just discussed before. So I'll go ahead and make that motion so that we can at least get that to the BOCC to discuss on Wednesday.
My concern there is what happens when CDC or governor or some other authority says, you know, you should be doing this. We're going to back it up at that point. I mean, they're doing it for everywhere, Joe. I mean, they are. And I mean, the Department of Public Safety, you can't get in there without them checking your temperature. That's a public building. That's you and I going in there. It's not the jail, not a court. It's not a court. It's nothing that you're technically required to be at. And I get that you're concerned about the civil liberties aspect of it and so on and so forth. But
you know, I saw this interesting. I love the news. Whether it's on the radio or the television. And,
Facebook,
I do not do Facebook.
Twitter.
I don't do Twitter.
You strike me as Instagram type.
I don't do Instagram,
TikTok.
No social.
whatever else there is. No, I don't do that.
That is socialism.
Because, you know, what's next? We're gonna thermal scanners like they're gonna start doing in New York City to take people's temperatures, and it is not. If it were the 100%, 100 degrees point 4 or higher, you have COVID-19, I would be all in.
Yep.
But it is not. And as we've discussed many times before, You can be a major carrier and be asymptomatic. And I saw a story this morning where Major League Baseball, and I'm not sure if it was all of the players and all of the support personnel, did antibody testing, and it was only present in I believe it was 0.7% of the entire pool tested. But of that 0.7% that came back as showing the antibodies, 70% of those people were asymptomatic. Yeah, it's the latest, the greatest, and it's a means of saying we're doing something.
I get
But
it.
at the end of the day, I don't believe that it's
99.9% effective. How many times do you put this on your hands? It's not 100% effective.
I think
No matter what we do, nothing's going to be 100%, but it's preventative.
I reckon.
It is a step in the preventative event. I mean, that's when you start doing all the preventative things, that piles up. Me wearing a mask is 7% effective. Me wearing a mask and you wearing a mask is less than 1% of you catching it. It's just
So
another initial step.
let's require people to wear masks. If you want to go there, I can get to that. We require them to wear a mask, and
Can we do that?
and we provide them a mask.
Can we do that?
Well, we've got offices saying that in their instructions that you want to do business with us. So until we get an answer from the DA, I think if we're gonna have offices in this building say, thou shalt wear a mask. Well, I, as an individual walking in, all right, provide me a mask. Because otherwise, I can choose whether or not to wear a mask into my grocery store or wherever. And I'll second your motion, by the way.
Thank you.
I have drafted a couple of signs. Should we consider posting signage in numerous places? One says that masks are required. Anybody over the age of 5 or pick 2 or whatever that number is are required to wear a face mask covering their nose and mouth at all times when in county facilities. So I've drafted that one. And then I've got one that talks about the symptoms, and you're prohibited from coming in these facilities if you exhibit these symptoms. We probably need another one that says something about you must maintain social distancing of 6 feet or more. Those could quickly be laminated and posted outside, inside, security, elevators, parking garage, wherever. But I think that's a step forward that we're a week away, as Miles said. And it's time to do something.
Actually should already be implemented to that degree as people who are coming in now.
Yes.
All of a sudden, what's the difference between next Monday and today?
Yeah.
Number of people per one. But that's the big one, but absolutely.
I mean, to them coming in, if they weren't required
Right.
today,
Agreed.
they're not.
Right. And if you're looking at masks in public places, it needs to be our employees as well as any visitors coming into this facility.
I think these measures can be implemented while we await word from the district attorney.
Who enforces this?
Who enforces what? No mask, no entry? Well, we asked our security that we contract with to enforce the no mask, no entry.
You would think people would adhere to that, but forgive me, but I saw you sneeze earlier.
Yeah,
In
absolutely.
close proximity to Dan Matthews, and neither one of you are wearing masks.
Yeah. You're absolutely correct. I mean, we're going to have to lead by example. I get it. I'm going to have to put one on. I fully understand it.
Don't sneeze anymore.
I've said that.
I've got it right here.
Okay, so David, somebody, in the initial stages of this, there was a resolution passed by the VOCC that contains some guidance, I thought, on entering the buildings. And even the Supreme Court, it ordered restricting access. And it was broad and right, if you were exhibiting signs or symptoms, if you had
That's
traffic,
Traveled within
travel,
30 days.
I don't know why If it was good enough then, I don't know why it's not good enough now. And part of the issue, part of the issue is we are going to have to, by and large, trust the public unless we're going to perform a full medical exam on them and our employees. By and large, there's going to be some trusting of the public involved. And so I don't know why we couldn't go back to the beginning. If you want to meet tomorrow, I'll make that motion that we meet tomorrow, and David or someone bring back what it is the BOCC passed in terms of, I just don't have it readily available, or, and we could look at that. And then perhaps come up with some recommendations. You know, and if part of it is you want somebody there screening, then, you know, a couple of questions, and it falls in line with some of the things that we talked about. And I think you may be able to get there. So have you had any of the following new symptoms in the last 7 days? Fever or chills? Sore throat, shortness of breath, or other flu-like symptoms? Yes or no? In the past week, you've been in close contact, less than 6 feet. Prolonged contact, more than 2 to 3 minutes with someone suspected or confirmed of COVID-19 without using infection protection. You answer yes to one or both? I'm sorry. But that still doesn't take care of the issue of those that have been compelled to be here, which I don't know is necessarily our issue, but we need to be thinking in those terms. And David, you've been working with Judge Elliott, and one of the things, you know, I mentioned that in reference to the temperature taking is, if we turn someone away at the door that is supposed to be here, how is that handled? Because the last thing we want to do is see additional people in our jail, which is beginning to see a population increase, in part because of the state, and in part because people are out and about again. And so, you know, if it's a matter of we're going to feel better if we're, quote, screening people, then I think a couple of questions, and I don't think
Where'd you get those?
that's the state of Maryland.
The state of Maryland.
There's multiple questionnaires of different entities, very similar.
Well, I think the information that we got from ACO included some of those same questions as well.
Well, I will also talk about temperature taking. et
Yes,
cetera.
I agree.
And Michael has seconded that motion. That's still on the table. So,
So let's do, I can do the questions. I'm good with that. I mean, if everybody else is good with that, without the legal guidance of the district attorney, then, and I think we've had some legal guidance from our.
I think to be fair to Miles, I mean, we could probably get a really quick answer on something like that, because we're not, all we're asking is a yes or no question. We're not asking you to expound upon, I'm not saying this is the end all be all, but I think it's a step. So if we could get what we passed in emergency resolution, take a look at the Judge Elliott's guidance again, the Supreme Court's most recent as well, consider some type of questions, take this temperature taking nonsense off of.
Let's clarify that, Mayor. Clear out the motion that we have in place. We have a motion and a second. Make a recommendation to BOCC to not move forward with efforts to take temperatures from people entering the facility, correct?
The courthouse and the annex, and
Okay, let's get that out of the way.
because for juveniles doing, and they're under the guise of the presiding juvenile judge, and our detention facility is something altogether different. And so my motion pertains to this building and the courthouse. I'm willing to listen to additional, if Michael's willing to listen on his second, additional discussions regarding other facilities.
Just questioning election board, social services. There's probably very little traffic in the highway district. Citizenry.
Election board's pretty tight.
Yeah, they meet you at the door. There's no,
They meet you at the door
can
now.
I walk around and see what you got? No, there's none of that.
They literally hand you stuff through the door, so here you go.
Social service could be bumpy with the pharmacy and ongoing activity of multiple entities out there. I wasn't sure what.
You know, on the pharmacy though, we can do curbside
I mean, even in the building, they're behind the
Yeah.
plexiglass now, in both locations.
And, this is only a recommendation. This is not the final say. The BOCC will have that final say. If they want to add those facilities or.
And this is specific to temperature. We can further address the questionnaire. I got a motion and a second. Any further discussion specific to that motion? Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Nope.
And Barnes is an aye. Motion passes. Thank you. Further discussion regarding questionnaire. There are several models available. The ACO document, other states. I'm sure likely the state health department has a model. I believe I've seen the city county health department model. Certainly review those. There are consistencies. You alluded to the travel issue. Contact with symptomatic or positive cases. Symptomatic issues themselves. They're all generic.
So does anybody have the ACO questions on hand? The reason I ask about ACO is because that was at least examined by McAfee Taft, and they represented ACO for a while. They're familiar with county issues, state law, et cetera. I think if those have been examined and they thought that those would suffice, maybe we would deal with those.
I suggest that we bring that back. Perhaps
we
develop some questions using ACO guidance and any other examples that we might have seen, and bring that back to our next session of this meeting, whether that's tomorrow or Wednesday. Or this afternoon if we want to recess.
It is this afternoon.
Further discussion under item number 7.
I have drafts of these two signs, certainly willing to modify, throw them away, adjust whatever needed.
Can you bring copies for everybody to the next?
I will be happy to.
Thank you.
Personal opinion is the signage needs to go up last week. So as soon as we can do that,
Well, I mean, we can do it now if everybody's,
I don't know that 1 or 2 more days is gonna make that much of a difference.
Yeah. I do know that in Judge Elliott's order, that talking about the symptoms, he only listed the first 3. The new symptoms that have been added in the last week or so were not in his order, but I certainly think we need to include it as well.
One of the things, I think important in how we go about this, but it's communicating this message. We talked about the signage and we can put something down on the sidewalk. But by the time somebody gets to the sidewalk, it's a little bit too late. David, you and I have talked in the past that these news scrolls, and I don't even know if they're doing it anymore, but are kind of canned in terms of what you can and you can't put on there. But communicating whatever it is that's ultimately decided by the BOCC to the public at large, whether that's through the county, something on the county website, individual officers utilizing their social media, for a coordinated message, perhaps reaching out to see if we can get some type of PSA. I know that OCCHD's got PSAs running on, I believe it's the Tyler stations, maybe others. But there's got to be some type of effort at outreach in order for this to be as good as possible, in my opinion. And so I'd also ask that you would think about how we might go about doing that.
I think a joint, I don't know if it hasn't been done since I've been up here, but I don't see a reason why we couldn't do a joint press conference to express the magnitude of the situation and the things that we're trying to implement to not only keep the safety of the public, but also our employees, our families, as we like to call them. the importance of following those guidelines. And again, I don't recall that ever being done while I've been here, so I think a press notice might, with all three commissioners, probably would catch some attention. Just a thought.
Yeah, I think Miles, that's a good idea. I'd say whatever they adopt and whatever policies they set, if they held something immediately afterwards, I would hope that that would be an open meetings issue because it's business that's already been discussed and established. Of course, there's nothing to prevent a media advisor going out that they're going to consider it and having the media come to the meeting, dealing with it that way as well. But I agree, some type of coordinated statement, in addition to the ability of them to reach out to their via social media, in addition to that would be great. Maybe David touch base with the news folks and just see.
Dan's proposed signage, what time frame do we need to recommend that to get it on the BOCC for Wednesday?
8:30 in the morning. 8:59 technically, but for the clerk's office, I'd say minimally 8:30.
Yeah, they request 8:30 pretty.
But we can have a special meeting.
Well, versus forward this as a recommendation, and then are they not allowed to change verbiage if they see fit?
So the first three were in Judge Elliott's order.
Yes. And the last 5 were the ones that were added, I believe.
Can we recess for 5 minutes and have some copies made of those?
Sure.
That way we all have them.
That's good.
And motion to recess until, let's go 1:05. Oh, wait. Then we dispense with non-motion. So, okay, recess until 1:05.
Second.
Got a motion second, recess to 1:05, Mr. Matthews.
Aye.
Mr. Brown.
Yes.
Mr. Taylor.
Aye.
Mr. Davidson. Aye. Orange is an aye. Stand recess until 1:05.
To receive recommendations from the response committee related to open